So where are we at with the recession? How are dentists doing in their practices? We did a common sense dentistry survey just on that topic of practice production, and here's what you all said when you responded to the survey. In the last 12 months, have your practice productivity numbers gone up by 10% or more, stay between 0 to 10, stay flat, go down 0 to 10, or down over 10%? Well, the good news is from 0 to over 10%, that is about, let's take a look at the numbers here, 76% of dentists say that their practice have either stayed flat or gone up anywhere between 0 to 10 and over 10%. And that is a real good turnaround. I'm glad dentists are finally feeling better about themselves in terms of the recession, because we definitely see our patients are feeling better about themselves there as well. In the next 12 months, you expect practice productivity to grow, stay flat, go down. Nearly 97% of you said it's going to grow. It's absolutely going to grow. You know, some said it's going to stay flat or go up a little bit, but a good, I'd probably say a good 83% of you here say that it actually is going to go up within 0 to 10 or 10 to 20, and that's a pretty good health. And this has always happened in the recession. You know, I've been in dentistry now 30 years. This is not the first recession we've gone to. Is it the worst? The worst that we've ever seen, no question about it, in the last 30 years. However, we do know what happens after recession. You know, dentistry is not recession proof. Nothing is recession proof, but it is very recession resistant. And, you know, a lot of dentists were able to still make a living during this recession and every recession that we see. But we always know coming out of a recession, people really start feeling good about themselves. They'll start paying again for dentistry, especially the elective services. You know, there are really two parts of dentistry when you really think about it. There's the pain part and there's the pleasure part. Pleasure part being anterior implants, being aesthetics, those things. Sure, that took a big hit during this recession. But those are the kinds of things that'll turn around, because the pain part of people coming in pain, they at least need an extraction. But some of them will go still for the endo and the crown and those kinds of things. They need at least a filling. That can still give most dentists an adequate income for a while during a recession. So we don't get hurt as much as other industries. But coming out of it, when people start paying for elective services again, gear up your offices, especially when you're taking a look at elective services like veneers, like whitening, like anterior implants, like posterior implants. Anterior implants, you know, kind of strides the area. For a lot of patients, they must have an anterior tooth, whether it's even just a flipper, but many times they'll go for an implant. But during a recession, posterior implants, that starts to fall a little bit. They can live without the back teeth because nobody really sees those kinds of things. But now we're starting to see the elective aesthetic services, especially as dentistry has become, has just, you know, exploded in the facial aesthetic realm with Botox and dermal fillers and all the different applications there, especially when you package that with veneers, whitening, and all the services that we do already. That's really going to take off as we turn around in this recession. And have you noticed an ability, your patient's ability to pay for dental treatment? So yes, now we're starting to see those numbers rise, where a lot of dentists are seeing the patients are starting to get a little bit looser with their money and starting to take a look at least at the aesthetic treatment plan. So I would recommend, and I've recommended throughout this entire recession, is keep up the marketing a little bit. Keep talking to your patients about elective aesthetic dentistry and now facial aesthetics and how all that folds together, because by doing that, just planting the seeds in their mind, now that things are starting to turn up for some people and they're starting to feel a little better about themselves, absolutely they will now start thinking about the seeds that you planted the last 3 years, saying, now maybe it's time for those veneers. Now maybe at least we'll spring for that whitening, or I'm a few years older, now we've got to really take a look and see what happens. It's amazing that, you know, the makeovers I've done over, even during the recession, of the 50-year-old male, okay, which happens to be, you know, my generation, the 50-year-old male who may have even lost his job or afraid of losing his job, he's now got to go compete with younger people. We see this with women all the time, certainly in the social sphere, but, you know, men and women, they've got to compete with younger counterparts now and they've got some money put away. They're investing it in themselves, whether it's veneers or Botox or fillers or all the different kinds of aesthetic services that now many dentists offer. It's amazing what we've seen in that realm there as well. So things are definitely looking up in dentistry. Gear up. You've got to be presenting treatment plans to patients, even though they may not be taking them now. You've got to, if there was ever a time for advertising, marketing, especially getting into social media, which we've talked about before, and your website cannot just be a yellow pages on the web. It darn well better be something that's tied into social media, and we've covered that in some of these other surveys, and we certainly will in the future. Take a look at some of those things. It's now more important than ever, especially as we come out of this recession, and patients are starting to look at and pay for some of these elective aesthetic treatments again. It's time to really put your efforts in that as well. So good luck. We're looking hopefully at a much brighter future in dentistry than the last couple of years, and it's really an exciting time to be in dentistry. We're here, and we're here for you, and we're happy to be a part of your success going forward.